Snake Antivenin BENOM, that is liquid type for IV use only. Product information and composition. The snake antivenin is a preparation from the equine plasma of hyperimmunized horses against 4 common poisonous snakes of India. First one cobra, that is Naja Naja. Second one common krait, Bulgarus caruleus. And third one Russell's viper, that is Vipera russelli. And the fourth one saw-scaled viper, Equus carinatus. First one cobra, COBRA, cobra. Second one common krait, KRAIT, krait. Third one Russell's viper, RUSSELLS, Russell's viper, VIPER. Fourth one saw-scaled viper, SAW, saw scaled, SCALED, VIPER, saw-scaled viper. The preparation is a refined globulins processed by enzyme digestion. Each ml of the serum neutralizes the following quantities of standard venoms: NLT 0.60 mg of cobra venom, NLT 0.45 mg of common krait venom, and NLT 0.60 mg of Russell's viper venom, and NLT 0.45 mg of saw-scaled viper venom. Preservative phenol IP more or less 0.25%, stabilizer glycine 1.7%, and excipient sodium chloride. The liquid preparation has to be stored between 2 degrees Celsius to 8 degrees Celsius. It should not be allowed to freeze. Treatment of snake bite. The management of snake bite victims call for quick and positive action. The following first aid measures are suggested. First and foremost is to remove the patient to a well ventilated and quiet place, infusing confidence in the patient and assuring that there is a major psychological factor. Efforts have to be made to combat the same. Second, ligation. Apply a ligature of some type above the bitten part to prevent the rapid absorption of venom. The ligature may be a handkerchief or a piece of cloth. A rubber ligature is by far the best. Ligature should not continue for over half an hour and must be released for a minute at intervals. Ligature should not applied if an hour or more less has elapsed after the bite. Third one, clean the bitten part with water without rubbing and dress it up with antiseptics, taking care not to rub the part. Immobilize the bitten part as for a fracture. Serum treatment. Only polyvalent snake antivenin serum can neutralize the venom in circulation. So the serum should be injected as soon as possible after the bite. As a first dose, at least 20 ml of serum should be injected intravenously very slowly, not over 1.0 ml per minute. The second dose should be repeated 2 hours after the first dose or even earlier if the symptoms persist. Further dose of the serum can be given depending on the condition of the patient. In case of viper bite, in addition to intravenous injection, some serum should be injected into and around the bitten area to prevent gangrene formation due to destructive nature of the viper venom on tissue. Symptoms in case of a elapine, cobra and krait, and viperine are as follows. As the reptile responsible for bites is seldom seen, it will be possible to follow the general symptoms associated with elapine or viperine poisoning. Cobra and krait poisoning. In these cases, general constitutional symptoms are observed than any local reaction like swelling, owing to the predominance of neurotoxins, there is creeping paralysis of muscles of eyelids, staggering gait, incoordination of speech, paralysis of limbs, dropping of head accompanied by nausea and vomiting. Death may ensue within a few minutes to several hours from respiratory failure caused by the neurotoxin. In crate poisoning, in addition, there are convulsions and violent abdominal pain due to internal hemorrhages. Russell's viper and saw-scaled viper poisoning. No paralysis observed in viperine poisoning, but a marked and severe local reaction at the site of bite is noticed and is characterized by persistent pain, swelling, and with oozing of blood from the bite. This is followed by generalized vascular injury, widespread internal hemorrhage with tenderness and vomiting. Death is caused by intravascular clotting. Serum reactions. Before treating the patient, it is necessary to inquire the following. First one, whether any serum injection has been administered earlier. Second, whether the patient has history of asthma, eczema or drug allergy. A sensitivity test is carried out by injecting subcutaneously 0.1 ml of serum in 1:10 dilution and observing for 30 minutes for any local or general reaction. In allergic and sensitive patients, it is better to inject the snake antivenin serum with antihistamines. However, the administration of serum in snakebite victims has to be decided taking into consideration the severity of the patient condition and urgency of treatment must override the danger of anaphylaxis. In such cases, it may be better to inject 1.0 ml of 1:1000 adrenaline intramuscularly at the same time to lessen the risk of anaphylaxis, and half of the dose of adrenaline may be repeated 15 minutes later should it be necessary. Associated treatment. In viperine poisoning, sedatives and analgesics relieve pain and nervousness. Use of corticosteroids minimizes the serum reaction and allergic manifestations. Administration of antibiotics is recommended to combat the local sepsis. Transfusion of a large amount of normal saline, better still, blood or plasma is helpful in near collapsing patients. Sometimes tracheostomy and positive pressure ventilation in case of respiratory paralysis or other additional measures. The presentation of BENOM liquid supplied in 10 ml vial. Storage. Liquid snake antivenin serum has to be stored between 2 degrees Celsius to 8 degrees Celsius in a refrigerator. It should not be allowed to freeze. Shelf life 30 months from the date of manufacturing. Thank you.